So we've discussed guns and the culture of violence on this program today, and now we go to mental illness and developmental challenges. As much as we may want to pin Newtown on a specific condition or problem, to make sense of the senseless, there are no easy answers. There have been reports that Adam Lanza's mother told family members and neighbors that her son had Asperger's, a form of autism, and that she didn't like to leave him alone. But experts say those with Asperger's are more likely to be victims of violence rather than violent themselves. We know when he was in high school, Adam had a psychologist assigned to work with him, but Adam's father says he never saw any signs of violence. Still, to do something so awful, something went terribly wrong. Mental health in America is a $113 billion industry, and according to experts, it is still not enough to treat all of those who need help. In the guest spot today, Dr. Ron Steingard. He's a child psychologist at the Child Mind Institute. Doctor, I think it's so important to talk about mental health, and I think we need policies that support that conversation. We have a law on the books. In 2007, the Senate passed the NICS Improvement Act. NICS is the National Instant Check System, which decides who gets guns, essentially. And that bill required states to report that those who were adjudicated by a court to be mentally ill or a danger to themselves or others or suicidal to this NICS board. I don't know that that's sufficient. It's a good start, but what else can we do in terms of policy to support a better mental health system?
Yeah, I think that's interesting because the way that's framed, it actually connotes that mental health is the only arena that you need to be careful about vetting when you're looking for gun control. And there's an implication in that's a group that needs to be separated for some reason that they need special care. I think the way you framed this segment was that this is something that we don't normally like to talk about, I think was the way you started this particular segment. I think, unfortunately, this is the only time that we talk about this for the most part. And this is a group of individuals who are exposed to significant stigma in terms of their ability to access care, let alone institutional barriers that are created. So there's a lot of work that needs to be done across the board in terms of not only allowing people to access this type of care without the stigma attached to it, but also promoting research that helps us to understand these disorders better and to think about creating more effective treatments for this group of individuals.
Doctor, you talk about the stigma that exists around mental illness. If your child had cancer, the world would rush in and hug you and your child. Absolutely. When you have mental illness, everybody's backing away, and I think it's almost human nature to think like that is weird, which is not the way that we are going to be able to help these families. How much does the stigma around mental illness make it difficult for people to get the treatment and support that they need?
I actually think there are three component pieces. I think stigma is an important part of it, and you're absolutely right. If I had a child with cancer, I could talk to my friends, I could say, I'm dealing this, could get sympathy, empathy for this, but if my child were seeking treatment for depression or anxiety disorder or ADHD, these are very controversial disorders at times, and parents are often reluctant, one, to go seek help, or to talk about it openly with their pediatricians or their friends or the schools. I think it's very clear in this country we deal with disorders that occur above the neck, disorders of psychiatry behavior, in a much different way with a much different approach than we do for disorders that affect other parts of the body, and that needs to change. Stigma is a significant component to this, but there are other component pieces that get in the way of people being able to adequately and quickly access care. There are institutional barriers that get in the way. There are problems in the fact that we really do not fund enough research to understand these disorders or to create effective interventions for these problems as well. That triad is really what creates a major problem in terms of people getting access to quality and effective care. The Healthcare Reform Act is largely, my understanding, is in part built upon a delivery system that looks towards quality and efficacy of care. We are woefully behind this in mental health, and there needs to be support for the development of these kinds of well-studied, effective interventions if
And Doctor-
mental health is going to be a piece of this this healthcare reform going forward.
Well, and let's talk about one potential specific reform, looking back across history of how we've handled people with mental illness. Initially, we basically did nothing. Then there was a reform movement in the late 19th century, which basically created this vast system of state mental hospitals, and the norm was to institutionalize people. Then in the 60s, there was a backlash against that. And now some are arguing we've gone too far in terms of deinstitutionalizing, that even people who are crying out for help for their loved ones, who know that they are a danger to themselves and to others, can't get them the long-term care treatment that they need. And one stat that sort of blew my mind was in 1955, we had one public psychiatric bed for every 300 Americans. Now it's one bed per every 7,000 Americans. Do we need more long-term mental health institutions?
You know, I've been around for a long time, so I've lived through cycles where access to care has become a critical issue for a variety of reasons. I don't think that necessarily building more hospital beds is the answer, and what concerns me about that is that it lends itself also to this out-of-sight, out-of-mind mentality, and I think helps to promote stigma as well. I think the issue is that we need to think about what are effective interventions for the types of problems that people are dealing with. And some people may need hospital-level care, but certainly people need other types of services that are closer to their homes and closer to the communities where they live. And it's just that we don't do enough to understand or to promote studies for a lot of these things.
Okay, Dr. Ron Steingart, thank you very much.
You're welcome.
The last three conversations have given us a lot to think about. We'll talk it all over straight ahead. Here are some images from Newtown as students go back to school today.